Here is a brief overview of the important milestones in the history of living kidney donation. In 1954, the first successful kidney transplant occurred at the Brigham Hospital in Boston. Dr. Joseph E. Murray and John Hartwell Harrison were the surgeons, and Dr. John P. Merrill, the nephrologist, who managed the transplant between the identical twin Herrick brothers. In 1959, the first successful living donor kidney transplant occurred between fraternal twins. In the photo, you can appreciate how significant the scarring was for donors undergoing open nephrectomy. The recipient, on the left, had both kidneys removed for medical reasons, while his brother, the donor, seen on the right, donated his left kidney to his brother. In 1960, the first successful kidney transplant between siblings who were not identical or fraternal twins occurred. As you will see in a few moments, 1962 marked the first successful living unrelated kidney transplant, meaning that the donor and recipient were not blood relatives, but rather were two people with an emotional relationship. During this time period, as living-related transplants grew and living unrelated transplants were introduced, steroids and azathioprine were the only two drugs available to suppress the immune system until the availability of cyclosporin in the 1980s, which revolutionized the field of transplantation. In 1964, Dr. Thomas Starzl, a pioneering transplant surgeon, published Experience in Renal Transplantation, a book that described transplant experience to date and served as an important reference for hospitals wanting to establish their own transplant program. The next major milestone of living donation occurred in 1984. At that time, the National Organ Transplant Act, also called NOTA, was passed by Congress. This act prohibited the sale of human organs and outlined fines and imprisonment terms that violators of this act might experience. In 1990, surgeon Joseph E. Murray, who we mentioned performed the first successful kidney transplant in 1954, was awarded the Nobel Prize in Physiology or Medicine for his pioneering work in the field of transplantation. Dr. Murray's interest in transplant stemmed from his experience with skin grafting during World War II. 1995 marked surgical innovation for living kidney donors, the introduction of laparoscopic surgery to perform the donor operation. Benefits of laparoscopic surgery included shorter hospital stays and recovery periods, less pain, and improved cosmetic result as compared to the open donor nephrectomy. In addition, 1995 marked the publication of an important paper by Terasaki and colleagues from UCLA. They showed comparable outcomes between spouse-to-spouse and parent-to-child transplantation, thus paving the way for an increase in living unrelated kidney donation and transplantation. In 1998, an important procedure for incompatible transplantation was introduced, called plasmapheresis. Plasmapheresis, a procedure similar to dialysis, helps to reduce antibody levels in the blood, thus helping to facilitate both cross-match and blood type incompatible kidney transplantation. 1999 is notable for the introduction of the Organ Donor Leave Act, which was passed by Congress to give federal employees paid leave when serving as living organ or bone marrow donors. This act led some state governments to follow suit for their state employees. In 2000, a very important document called the Consensus Statement on the Live Organ Donor was published in the Journal of the American Medical Association. The consensus statement serves as a guideline for healthcare professionals to provide optimal care to actual and potential living donors. Also in 2000, the concept of paired exchange for living kidney donation was introduced. This concept enabled two cross-match or blood type incompatible donor and recipient pairs to swap donors in order to enable transplantation. This concept has greatly expanded since that time and now serves as the foundation for today's kidney paired donation programs. 2001 marked the first year that the number of living kidney donors exceeded the number of deceased donors, although unfortunately that trend has not continued in more recent years. Since 2005, the number of deceased donors has again exceeded the number of living donors. 2001 also marked the year that New York State followed in the footsteps of the federal government and passed a law to provide paid leave to state employees who serve as organ donors, just 2 years after the federal legislation was passed. In 2003, Department of Health and Human Services Secretary Tommy G. Thompson declared April as National Donate Life Month. Secretary Thompson was very involved in healthcare issues while he served, and chose to designate this to promote and educate the public about organ donation, both living and deceased donation. 2004 marked the passage of the Organ Donation and Recovery Improvement Act. This act provides living donors reimbursement for non-covered expenses related to their living donation, such as travel, housing, and other non-medical expenses, such as childcare. In 2006, the Institute of Medicine published Organ Donation: Opportunities for Action, a report that addresses important ethical issues that affect living organ donation, as well as pushes for improvements in education and in the donation system as a whole, again for both living and deceased organ donation. In 2007, clarification of the National Organ Transplant Act occurred via the Charlie W. Norwood Living Organ Donation Act, which established that kidney paired donation is not considered valuable consideration as defined by NOTA. This act is very important given the growth in kidney paired donation in recent years. 2008 marked the first single-site surgery for organ donation, in which a single entry port at the umbilicus, or belly button, is used to perform the laparoscopic donor surgery and removal of the kidney. More research is needed to see if this procedure provides benefit over the traditional laparoscopic surgery for kidney donors. In 2009, an important campaign called End the Wait was launched by the National Kidney Foundation with the hope of eliminating the kidney transplant waiting list within 10 years. Living kidney donation is of great importance to the success of this campaign. 2011 marked the passing of Ronald Lee Herrick at the age of 79. He died 56 years after serving as the first successful living kidney donor by donating his kidney to his identical twin Richard Herrick back in 1954, which allowed Richard to live for 8 years after the pioneering transplant. As you can see, living kidney donation has experienced rapid growth in recent years. It will be very exciting to see what developments occur in the next decade.